hematologists at King's College Hospital. I'm also the chair of the British Liver Transplant Group. That's the main representative body for the transplant community, liver transplant community in the UK. The shielding guidance is there really to try to protect what most public health experts would call the highest risk groups from contracting this virus. We've had 6 patients at King's who got this virus after transplant, and all of them are doing well. That's not to deny that there is a risk, and that's not to deny that there's a higher risk than the general population, but it doesn't mean that that the outcome is always going to be gloomy. There are really now good data from European studies that suggest that organ transplant recipients fall into that category of highest risk patients. There are also some patients who are before transplant who are on immunosuppression for different forms of liver disease who are particularly ill, and in a very small number of patients with unusual diseases and liver disease like cystic fibrosis that fall into that high risk, extremely vulnerable category. So the shielding guidance was brought in to try to minimize the risk of those people catching this dreadful virus, to minimize the risk that it will have a bad outcome. So along with the transplant patients, there are other groups that have been defined as being of extremely high risk and vulnerable, and those include people with liver disease who take immunosuppression drugs. So people with autoimmune disease who are on steroids and other forms of immunosuppression that can include azathioprine, mycophenolate, or tacrolimus are also regarded as extremely vulnerable and should be following shielding advice. Again, emphasizing its advice, and it can be judged after consultation with your doctor on a case-by-case basis. So at the beginning, I think decompensated liver disease was not covered in the extremely vulnerable high-risk group. I have to say most doctors would say they would be at higher risk, because we know that when people's livers are at that end stage where they're decompensating and, in all honesty, being considered for transplant and other things, that your immune system is really not working very well. And we know that from lots of data that they're more susceptible to bad influenza and other viruses and other bacteria as well. So I would have said anyway that they are probably very vulnerable, and the new guidance takes that into account and puts them in the same category as having guidance to shield. I'm amazed by what patients have done. I am genuinely amazed. I think I'm a little bit amazed in general about what society has managed to do with social distancing, hand washing and things in complying with guidelines. But I think what any normal human beings had to do can't really understand what shielding entails, because that is really, really high level constraints on your normal life, seeing the people you love, having physical interaction, all of these things working. So I think my advice has always been right from the beginning that it is guidance and it needs to be taken in the context and the round of your life. Up who have made very eloquent point that whilst they've tried really hard to shield, it's come at quite a big mental cost for them and their families. And could they undertake some very safe exercise by going out at 5:30 in the morning and walking their dogs in the countryside and not meeting anybody? And I've said I think that's absolutely appropriate and the right thing to do. And again, this is all about balancing the cost and the benefit in each individual case. I would say, remember its guidance. It needs to be individualized after consultation with your doctor. The new updated guidelines take account of this now and say you can go out. You can't live in a prison cell, which is to some patients, that's effectively what it felt like. And so you can go out, you can, within your family, go out and do exercise and see a bit of sunshine and hear the birds singing. And if you live alone, you can do that ideally with one other person. With slightly different guidance in different parts of the UK. In Wales, for example, it's unlimited exercise. In England, we're still saying optimally one exercise session and with your family and or one other person if you're socially isolated. So it's slightly different in different parts of the country. a huge number of patients who have extremely mild chronic liver disease, some of whom don't even know they have liver disease out in society. And those people really probably are not at any higher risk if you take out all the factors we know about being from BAME backgrounds, age, diabetes, hypertension, those things we know about. They're probably not at any high risk. But those people who have significant liver disease, I would say, should consider themselves, this is my personal opinion, as being in that kind of category of risk, that having that disease probably does slightly elevate their risk of having serious complications from coronavirus infection. And so they should be taking all the precautions they can whilst living their life with social distancing, hand hygiene, contacts, etc. We're all available to be talked to. We all know our patients really well. And of course, the coordinators are always there to answer questions. So please contact us if you need clarification about your specific case.